Welcome back to the show, Dr. Brenna, to the Raw podcast.
Very excited to be here.
And if the viewers and listeners have not seen the first podcast with Dr. Brenna, you need to go back and watch it before you watch this one because you'll learn a lot more about her. And she was actually pregnant when you were last on our show. So tell me, you've had a baby?
I have. Well, he was supposed to be born at the end of May, but he was actually born at the end of March. So that was interesting. But he's almost 7 months now and so cute.
Oh, he's adorable. I know. We're going to have to put a picture up for later so everyone can see. Okay, so you know what? Let's just talk about pregnancy. Let's see, like, how was this pregnancy versus your first pregnancy?
So interesting. So I did it 10 years apart, right? So 10 years ago, I had twins and then recently had little baby Mateo. And even though they were very similar in that my twins were born at 30 weeks and 6 days, and at 30 weeks and 2 days, and he was born at 30 weeks and 6 days.
Wow.
We spent 8 weeks in the NICU with the twins and only 6 weeks in the NICU with him. It was very similar. But my postpartum experiences couldn't be more different.
Yeah, you look fantastic.
I feel so much better than I did after the first ones. And yeah, sure, it could be because they were twins. They were also tiny.
Right.
And it's a lot easier taking care of one than taking care of two. But
you're that much older.
Yeah.
Right.
So I didn't expect it to be that much easier. This one was a natural vaginal delivery compared to a C-section. So that obviously makes a difference.
Right.
But just like the recovery was, I almost don't want to say it because I know how hard recovery can be, but like I feel like I went back to normal really fast.
So what do you contribute to that? Like, did you change your diet? What was different?
Well, I mean, I'm a different person, and I think I had done a lot more work on myself in the 10 years between, and I was in a much better headspace. But I also think it had a lot to do with just how I treated myself. From a nutrition standpoint, from an exercise standpoint, from a lifestyle standpoint. With the twins, I was finishing residency and you just get in that rat race, right? Of more, and exercise harder and eat cleaner, whatever that means. And it just felt really hard. Like I remember with the twins, I would get up almost every morning at like 5 in the morning and go for a run with them in the double stroller because like I wanted to get back to feel like myself again, right? It wasn't even about size or weight or anything like that. It's like I don't feel good at all. I haven't done anything with this one.
Really? No, say it. It's okay to say it.
No, like I've done nothing.
Wow.
Like we moved and I worked in the garden outside, but like I haven't done anything.
Can I be so bold to say that? Do you think you're maybe just happier this time around? Because you're
Probably.
kind of in a shit marriage, and can I say that? Okay, sorry.
It was harder. We were
Right.
we were definitely at a harder time in our life.
Right.
Yeah, everything is just so much easier in all aspects. And so I've really spent a lot of time thinking about why. Because I thought I was healthy before. I thought I did all the right things and read all the right things. And it's almost like I stopped trying so hard and it got easier.
It's interesting. So can you figure out, like, what do you contribute to?
So I do think diet has a lot to do with it. I think I don't know if I mentioned anything about my now husband.
Yeah.
But
He's so
he does vertical farming, and he set up like in our backyard a whole thing with all the vegetables we could possibly want and fruit and the whole thing. And so we would go out in the morning and like pick vegetables and fruits from our garden. And I mean, we live in Old South, so it's not like I have a big backyard. It's tiny, tiny.
Right.
But I just noticed like cravings were gone. Like I would have a handful of the tomatoes that we grew in our backyard and I'm satisfied.
It's because there's not the chemicals and all the crap on
Yeah,
it, right?
yeah.
Like I do feel that has something to
Yeah,
do with.
it must.
Yeah.
So I've started kind of looking more into this again, just sort of being like, why was this so much different and what could be, and obviously there's a lot of different things. But as a family doctor, people come ask me all the time with, especially with Ozempic, that's like a big craze now, right? How do I lose weight? How do I quote unquote be healthier? And it just got me thinking and reading, and so I reached out to you to just be like, I feel like we're missing the idea of what health can be. Like we're making it
Yes.
a lot more difficult than it needs to be.
Okay, so if someone was to come in to see you and say, that's the other thing too. Like, how do you deal? Like, nobody's ever coming in saying, Dr. Brenna, I'm so fucking happy today. Like, I have no ailments. Like, you're always dealing with someone's problems
Yes,
or
that's the
ailments,
point.
right?
That's
yes.
the point.
Right, exactly.
Like, that's the point of medicine, right? And
Right.
that's the other thing that you and I were talking about is, medicine, I don't think we're at a place where everybody understands the same goals.
Right.
So what I mean by that is like, hundreds of years ago when you went to see a doctor, why'd you go see a doctor?
Something was wrong.
Because something was wrong. You were dying, like
Yep.
somebody was bleeding out, right? We didn't
Yep.
really know very much. And it was like, here's the very small toolkit that we have, and we'll try and keep you alive.
Right.
And then over the last couple hundred years, we've discovered all of these different things. And now we have treatments for this and treatments for that. And, we're going down into the nitty gritty of, some of the studies you look at, the effect size is so tiny, and we're trying to decide, well, is it better to do this or better to do that? And it's not about, it is about keeping people alive,
Mm-hmm.
but we've somehow like marketed it as we're trying to make you really well.
Yeah, and I feel like people's goals nowadays is to live longer, right?
Better.
Right.
Or longer, but that's a really important distinction. Like, which one is it? Because it's not both,
No.
right? They're not the same thing.
So, okay, let's just use an example. Someone comes in to see you and they say, "Oh, I'm just not feeling myself. I kind of feel shitty. I want to lose weight." What are like take us through some of the steps. Like, are you right there to prescribe them something or
Hopefully not.
Yeah, hopefully not.
Hopefully not. I mean, we could talk for another 100 hours about the healthcare system and how doctors get paid and how, it's easier to just write a prescription than it is to go into detail, because it really is. And it's not easier in the way that like we're lazy. It's a matter of survival. Like you can't have that discussion 20 times a day in 5 minutes each time, right? It's just impossible. And so if somebody came in and I had the time and the space and they had the time and the space to talk about it, I would want to talk about their childhood. I would want to talk about their relationships. I would want to talk about their nutrition, their sleep, their activity level, medications that they're on, things that they've tried in the past, all of those other kinds of things, because they play a huge role in why somebody may or may not feel well. So, trying to think of an example. Like one of the biggest things that family doctors hate is when somebody comes in saying they're tired or fatigued. Because it can be like 1,000 things.
Right.
And when somebody comes in saying I'm tired, what I hear as a doctor is fix that. Right?
Mm-hmm.
And maybe that's not what you're asking, but that's what I'm hearing. And so I want to try and figure out how to make you feel not tired. And whatever you say can direct me one way or the other, right? So, I mean, are you sleeping? Or if you're having trouble sleeping, why are you having trouble sleeping? So I actually saw somebody, I'm doing a partnership with Rebirth, which is super fun and I'm really enjoying. But one of the women has an 8-week-old.
Okay.
And one of her complaints was that she's tired. And I was like, no shit. Like, I don't know how to fix that for you.
Right.
You have an 8-week-old. She has a bunch of other kids too. And so that's not the only thing, but it's like, okay, yes. But is it more than just that? And that takes a really long time to figure out. Are you anemic? Are you depressed? Are you, low in some sort of micronutrient that nobody's looked into? Or are you taking a medication that makes you tired? Or are you burnt out at your job? Or, right?
Right.
And
There's-
all of these things lead to the same result, but it's not the same reason. It's not the same treatment.
right.
Or maybe you have narcolepsy, which is like the disease where you keep falling asleep and then you need a medication.
Right.
But there's so many different reasons.
And do you feel, as in the medical field yourself, like that what's your take on the whole medical field? Like, do you think that it's doing a good job? Do you feel like since COVID, it's like kind of, I keep hearing it's an in and out, the doctors don't care, you're as overwhelmed as everyone else?
Yes, all of those things. I do think that COVID was really hard for people to see the medical system not actually know the answer. That's at least what my discussions with people have been. Um, going through undergrad, going through med school, like I'm used to the idea that what I learned today probably will be wrong tomorrow. Because we'll not wrong, but like, do you know
It's
how,
relevant.
well, not even less relevant, like we explain things to kids in a way that they can understand.
Mm-hmm.
And then when they get older, we explain it again in a way that they understand. But the first way they might think was a lie. I don't know how else to explain that.
No, that's.
So, like Santa, right?
Mm-hmm.
Or I'm trying to think of something that we explain almost with like a story, and then
Mm-hmm.
later on we tell you what really is happening
Right.
because you couldn't understand it
Back
if we
then.
told you that way. Does that
Right.
make sense?
Yep. Totally.
And so I feel like we do that in science a lot is we'll say, oh, it's this thing because that's all we understand. And then as we understand more, we go, oh, no, no, no. Like it's actually this other thing. And we did that with COVID in a short period of time. And I think people got to see it.
Right.
And that really scared a lot of people to say, oh, you don't actually know what you're talking about. But for I think a lot of people in medicine, it was like, oh, that's what we do with everything. Like, well, we know this much, and we tell you that, and then we know a little more, and then we tell you that. Um, and so I think that that scared a lot of people away, saying my doctor was lying, or the healthcare system was lying, or, they purposely misled us, which I don't think is true. I think everybody did the best they could with the information they had when they had it.
Exactly. Exactly.
And the information changed. I mean, I had conversations with patients at the beginning of COVID who said, should I get the vaccine? And I said, based on everything I understand and your risk factors, I think so. Then I had those same people come back and say, should I get the 5th dose of the vaccine? And I'm like, I don't know. Like, I don't know. I don't know. It's not a solid yes at that point, right? So people have lost some faith in medicine. Um, there's been more discussion about pharma and how that influences different things. It's funny, today in the clinic, we had a drug rep come in and give some information about the RSV vaccine. I don't know if you guys have heard about the RSV vaccine, which is now going to be funded and available for all babies. So my twins, when they were born, they got it because they were born in November, and that's during RSV season. But the baby, he didn't get it, even though he was born the same prematurity because he was born in March, and that's not RSV season. And so now they're saying everybody gets the RSV vaccine. So I was talking to my nurse, and I was like, when you talk to the rep, like, why did he say everybody gets it now?
Right.
And she's like, oh, well, everybody who was born in 2024 who has these risk factors in 2023. I'm like, no, but like, why does everybody need it now? And we kind of came to the conclusion that, well, because it's publicly funded, so now everybody can get it. And I'm like, I don't think I'm going to recommend it to everybody just because the government's paying for it.
So I do feel like you're one of those doctors and people that are so much more open than just writing a script. Like
Right.
yeah.
Yeah.
Do you find that your peers are like, what are you doing? Are
I
you?
don't think so.
No.
I mean, I think that I've had a little bit more space to do that in the way that I've done my practice. So we're actually just becoming a different kind of practice now, which can be a lot busier, but I've tried to structure it in a way where I can take time.
Right.
Financially, that's not awesome.
Right.
It hasn't been awesome. And so we're transitioning to that other model. But I do think people get into medicine because they want to help people.
Mm-hmm.
And that kind of goes back to what we were talking about, right? If somebody comes in and they're tired, I want to help them.
Right.
I want to make them feel better. If they don't want to talk about their diet and their exercise and their whatever, they just want me to make them feel better, well, then that's what I'm going to do, or I'm going to try to do.
Right.
So it's almost like you have to know what the questions are to go in with, and you have to be upfront about your goals.
Yeah, I think so. Can you recommend to like the listeners and viewers about how to talk to their doctor? Because I know there's a lot of frustration with that. Like, so for example, one of the questions that we have here is how can people approach their doctor when they don't agree with the modern medicine or treatment?
Don't say that. I think going in with your goals is really important. So if somebody says, I'm tired, the next thing should be, and I want to know why. Or, and I don't want to be tired anymore. Or, and whatever it is that you're hoping to get from that.
Right.
Right? Because that helps direct what we're going to do. Right? Also, asking, what do you think realistically can get better? Like, how much better can I get from here? Because sometimes people's expectations are completely unrealistic. But like, give me an example. So of something that you would go in with, like, I don't want to do the modern medicine strategy. Like what?
I'm going to throw this to Beth because I know you've struggled a little bit with your family doc. I know I'm putting you on the spot. I roll. Do you want to explain? Like, are you comfortable with it? First of
Yeah,
all,
so I've had constant issues with like my period and being in massive pains to the point where I couldn't go to work. And when I went in, he finally got a specialist, but the comment to the specialist was mild cramping.
See, I mean, that just feels invalidating.
Yeah, so but then I got pushed to the bottom of the list for mild cramping because obviously everybody who has more severe symptoms went ahead of me. But then when I finally got to the specialist, he's like, how long have you been like this? I'm like, 2 years. Like, I've been waiting to see you. And he was like, you need surgery. So it was just frustrating because every time I go in, I just keep getting told, oh, well, you're on the waiting list. Like, I've already referred you. I can't do anything more for you. And even though I kept trying to advocate, I just kept kind of hitting that brick wall and not having like the educational knowledge in that area without going down the Google rabbit hole of information.
Yeah.
You trust in your medical system, which at that point severely failed me. And
Yeah.
it's
I mean, it's
not,
hard to know what happened
I
at that
also
point,
like hearing
right?
what you just said about like these are my issues and then elaborating.
Yeah.
He didn't always give me the opportunity. Maybe I really needed to force that opportunity to elaborate more with him. But I always, since COVID especially, really felt rushed every time I was in.
Yeah, that's our
Because
system.
It's just the way it is.
That's just
and
our
that's
system.
Not his fault. I hear it from everybody saying that.
Yeah, I know. And that's our system. And that's, I think, why there's so much advantage to people taking back some autonomy and responsibility for their health because then you're not going to somebody else who pretty much has no time, right?
Mhm.
That's what everybody's saying. There's no time.
Right.
To fix some of those things. I'm sorry you went through that. That's awful.
Yeah, but you know what? The specialist did an amazing job.
Good.
The surgery he did was perfect. I've
Good.
been in no pain since. Like,
Amazing.
I'm
That's awesome.
super happy with the end result, but
Amazing.
it's upsetting to think that it could have been done like a year or more earlier if he had had the right information.
If it could have,
Yeah.
which is the other question,
Yeah.
right?
Right.
Like, there are some people who I see who I want them to get in tomorrow. And it doesn't matter what I say, I can't get them to go
Yeah,
anywhere.
completely understand.
Right? So hard to know, like, had he said severe cramping, how much sooner would you have gotten it?
Yeah.
I don't know, maybe.
Yeah.
Or, you know,
There's just a lack of information provided too. Like that was like one of like the 10 symptoms, right?
Right.
That he focused
Yeah.
on. But it is what it is. But I think for people that are being like advocating for themselves, it is really hard to keep kind of getting
yes,
the door closed in your face a bit.
yes. And that's where I would say, unfortunately, you probably need to talk to somebody other than your family doctor,
Yeah.
Yeah.
right? And
that's what I feel we need to start doing. And these are the conversations that you and I want to start having.
yeah,
Is that you can't just, and no disrespect to you, but you
no
can't
disrespect taken.
give everything just to your family doc. Like you got to take the onus on yourself as well. You've got to say, okay, I don't like the answer that my family doc just gave me. I'm not like, I don't like taking medicine. And yes, sometimes maybe I do need medicine, but can I actually fix this with sleep, exercise, diet? You know, what am I doing to help myself instead of just coming to you with the problem?
Yes.
So, and that is beautiful that we're starting to
Yeah.
have these
And
conversations.
like in your situation, there's probably some pelvic physio or naturopath or chiro or somebody who might have been able to help you get one step further down that.
I ended up getting like going to a chiropractor because I just got tired of waiting for the specialist.
Right. And that's
So it alleviated some of it, but
and that's where people are going.
Meds either.
That's where people are going. That's where people are doing.
Right.
And it's good, but it also, you know, really sucks for the doctors because we do have a lot of knowledge that we would love to be able to share. We just don't have any time.
Right.
And so if there was some way to like get a private hour with a doctor, you know what I mean?
Right.
Instead of continuing to book in 5-minute increments because that's all we have, I think we could do so much more.
How do you see that being alleviated? Like, how can we, or like from your perspective, like, how can you give us more time? Would you take less patients?
Well, you would have to, but it's also exhausting to say the same things over and over again, right? To have the same hour and a half conversation over and over again, which is why I think people just learning more about health in general and going back to the really basic components of health, right? So many illnesses that I can think of where we can go down the rabbit hole of blood work and investigations and diagnosis and specialists. And like at the end of the day, the treatment is sleep more, eat better, have less stress, right? Like
Yeah.
we can go find out what the problem is, but at the end of the day, for a lot of it, the solution is what you could have been doing all along. And so I think if we, you know, as a community start to talk more about how do we build healthy behaviors,
Right.
then there'll be a lot less disease to start with, right?
And that so many people, I think we've gotten to this mentality that everyone's looking for a quick fix and nobody wants to put the work in.
Or they don't know how. That's a lot of it,
Exactly.
right? They don't know how, especially with diet. Like,
Oh my
how many
goodness,
different
there's
diets
so
are
many
you supposed to be on?
And we spoke about this, right? Like, you know, if you're doing keto and you feel amazing on it, people are like, oh, keto's not good for your heart. Like, you should be doing it. But why have we stopped listening to our intuitive selves?
Yes.
Right?
Yeah.
If I feel amazing and I come to you and you're like, okay, what are you doing? And I'm like, I feel great, Dr. Brenna. Hopefully you're going,
Go for
okay,
it.
go
Carry
for
on.
it.
Why are you here?
But exactly. I just want to see your face, right? But I know, but when you say, like, the minute you start telling someone that you are doing keto, for instance, right? Oh, you shouldn't do that. Like, oh my gosh, you need to da-da-da-da-da-da-da.
Well, a lot of the reasons why people tell you what you're doing is wrong is because either they tried it and it didn't work for them,
Right.
or they don't want to try it and they don't want it to work for you.
Which is so sad to think about. Like, but
It's not intentional, but it's
No.
like, you know, if you're feeling good and I'm not, I want there to be some reason that isn't my fault that I don't feel good,
so true.
right? So I want it to be someone else's fault for some reason, some other thing that I don't have control over, because then I can feel better about it.
So how do you guide someone that might want to go down the weight loss journey and there's so many different things coming at them? Like what do you recommend
Why do you eat?
to survive?
Really?
Well, some
It's right. Some. What's the rest of it?
enjoyment,
Okay.
maybe. Are you asking me personally or just in general?
Just in general.
Yeah, I think people eat because it's a social thing. I think that it's loneliness, maybe numbing something.
How do you feel after you eat?
Yeah,
Right?
depending on
Depending on how or why. Do you even know how you feel? Because if you've had trauma, you're probably so disconnected from your body that you don't actually know if you feel good or not. You're just
Right.
sort of doing it automatically. So, at the risk of sounding like a broken record, I think treating adverse childhood experiences and making sure that the kids that are growing up now are well taken care of and not pampered, but like treated well, right? And learn about emotions and learn about what they mean and learn about what they feel like in our bodies because they feel like something in our bodies. It's
okay,
not
like, come on, how many? I'm telling you, I've never heard a doctor speak like this, and I wish because that is so much of the reason why someone that has gone through trauma does eat, right? But no doctor has ever said that, and I love my doctor, but it's just not. Again, it's no fault of the doctor. It's just never been the way you've been taught,
It's just, but it's also not what people want to hear,
right?
right? Like when
So they're
somebody,
probably coming in going, "You're not my therapist."
yeah, they're like, well, but what do I eat? And I'm like, well, I don't know. Like, what makes you feel good when you eat?
Right.
What do you eat? When do you eat? Why do you eat? Right? What kind of food are you eating? If you're eating large amounts of home cooked, what it's probably fine. Or you can eat a little tiny bit of processed stuff and feel like crap. So I don't know. Not a lot of people like not having the answer, I think. And that's probably the other thing in medicine is that we're all pretty smart people. We've all been told our whole life that we're good at things, that we get the right answer, right? And it's hard to feel comfortable saying, I don't know. Like nobody gives you gold stars for that, ever. In fact, it's the opposite.
But when I know it's hard because I sit there and go, I'd rather have that and not have the answer and be honest and authentic and say, I don't know.
But then people say, well, my doctor doesn't know anything.
Yeah, my doctor's supposed to know all this, right? So it's pressure. But I feel like you're right. There's so many alternative ways other than prescribing a pill.
There's lots. Sometimes just listening to what the problem is can be really helpful. And I do think our sort of non-OHIP covered colleagues do a much better job of that than we do. There is actually, and I'm not going to go into like the neurobiology of it, but being able to express what's going on and feeling heard
Oh, it's huge.
is in itself a treatment, right? That actually makes people better. Just being able to resonate with another human being in a way that makes them feel validated.
Yeah.
Right?
Or that they're not alone. Like, when we start talking like this, people at home are probably like, okay, like I felt like I was the only, because we tend to feel like we're the only ones going through something. But the minute you start chatting about it, you're like, oh, wow, you went through that too? Oh my God, you're feeling that too?
Yeah. And
So
pain is even like that. So I did a bunch of addiction stuff and it's kind of a tangent, but I think just having a little tidbit of that sort of understanding of how the science works can be helpful for people. And there's these types of information about all different kinds of things. So opioids are a big issue, right? Opioids are addictive. There's the lawsuits, there's the homelessness, there's all this stuff that goes with opioids, right? We know, so if we take a mom rat and a baby rat, okay? If you give the mom rat morphine, she will stop caring for her baby. If you give the mom rat naltrexone, which is the opioid blocker, she'll be more involved with her baby. If you give the baby morphine, they will stop looking for their mom. If you give them naltrexone, which is the opioid blocker, they look for their mom more. So that drive to reach out, that caring, right? That's mediated through the opiates system. So when somebody is withdrawing from opioids, it feels like they just lost the most important person in their life. It's like that little baby, right? Who doesn't have their mom. That's actually what it feels like. And if me as a provider, when somebody's going through opioid withdrawal, I can be with them and sit next to them and make eye contact with them and say something kind, well, I'm providing them with some of that care that triggers their natural opioid response. And so I've seen it where withdrawal is less severe. You can measure it on a scale when you're with people who are kind versus being treated like crap. Right?
Yeah.
And so you can imagine how you go see your family doctor, you get 5 minutes and rushed out the door. You go see your naturopath, your chiropractor, your physio, your whatever. They look you in the eye, they sit down, they talk to you for an hour. You feel better.
Right. 100%.
100%. Everybody does. Why wouldn't you?
Yeah. And
So the system is set up to fail, right? And we keep going to the doctor and to the hospital and to fix these problems, but we don't have the tools to do it.
Yeah.
We don't have the understanding to do it.
And just you opening up and speaking about this is huge. Like it's really like, I think it will give people at home peace that might not, like Beth, for you, for instance, just the experience you had with your doctor, like it probably sheds a little bit of light on the situation from your perspective and what's going on, and that, doctors really do care and you'd like to, yeah, exactly. Otherwise, why would you get into it? It's
And
not
so
for
I'm
the
sure
money.
your doctor was like, I'm going to send this referral and I hope they get in.
Right.
And then every time you come, right, the only thing they can say is, I've done the referral. But like the unspoken, I think, thing is, I'm sorry I can't do more, right? Like, why are you not happy with what I've already done? I feel crappy because I can't do any more for you. And every time you come, you remind me of the fact that I can't do more for you. And that makes me feel bad about myself.
It's like a vicious
Yeah.
cycle.
And so it can come off as standoffish, like, stop coming here to tell me that. I've already done what I can do. I don't know if that makes any sense.
Yeah, I got
Yeah.
it.
Even though, that's not helpful for anybody, but
Yeah.
that is how it feels sometimes.
It's crazy. I know. It's got to be exhausting for you.
Oh, yeah, sometimes.
But I do feel like you're really trying to make a difference. I know that you're holding a lot more space for
Yeah,
women that come through the door, not just women, but,
trying to, because I think in the long run it will make a difference.
right.
And that's kind of one of the reasons why I wanted to do this, is because I think we can help heal each other
Mm-hmm.
if we understand how the whole system works.
Right.
I'm not big into religion, and I know some people are, and that's fine. But you used to go to somebody to talk. You could go to your priest or your minister, and they were trained in sitting and holding space, right? And listening and giving advice.
Right.
And it didn't cost you anything. And it was culturally appropriate. And it was sometimes not helpful, but just having a community that you could go to and say, I need this, or I'm struggling with this.
Right.
There's a million different examples of when they did not do a good job with
Right.
that. But that's what I mean. Like, we used to have community where we could go to sort of help each other debrief, I guess.
And I think too, back in the day, when I look back to my parents and when I would be like this little girl going to the doctors with them for whatever their ailments were, like the doctors were at my wedding, like they just were a part of the family. Like you really trusted, put everything into the doctor. Well, if Dr. So-and-so says this, then it's gotta be right.
Yeah, there were so much fewer things we were expected to manage.
Yeah.
But I think we did almost a better job managing a lot of those things by doing less.
Right.
Right. And that's kind of what I mean. I wish that everybody had somebody they could everybody had a nutritionist, everybody had a therapist, everybody had, access to pesticide, hormone-free, locally grown food,
Mm-hmm.
I think it would solve a lot of our problems.
Food is a big thing,
It's a big
right?
thing.
Like there's a lot of stuff in our food, and all when you look at today, all the things that the diseases that are coming up and showing up in young kids, right? Like I don't remember ever having a kid with a peanut allergy growing up, or asthma, or some
Yeah,
of these
asthma,
things, right?
diabetes. in
Exactly.
kids. It's wild. Well, I mean, we could go down that rabbit hole, but I grew up with low fat as being good, right? Everybody, low fat was the good thing.
Right.
We now know it's because the sugar industry lobbied for sugar to not be the bad guy, for fat
Right.
to be the bad guy, and then the guidelines about eating and all those other things. And we now know that like fat is actually not what makes you fat. It's actually sugar that's the problem. But we spent a really long time teaching people sugar's fine, right? I mean,
All those sugar cereals
that's what I mean.
and
Sugar
right.
cereals are like, going, I thought it was better to have a whole bag of licorice
Mm-hmm.
than some nuts,
Isn't that crazy?
right? You think about it now and you're like, what was I thinking? Except that's what we were taught.
And it's hard to rewire that, right? Like when it's been ingrained in us that this certain food is not, because I was always taught growing up that I cannot have fruit because it's so bad for me because of the sugars, but yet I could eat a chocolate bar and, right? Like that to me. So now eating a banana for me is like, wow, is it okay to eat that? Right? So yeah, it's
Yeah.
when you've got
It
it
is.
stuck in your head, it's messed up.
It is. It is.
So-
and even just trying to, debunk a lot of that takes a
Right.
lot of time.
So what do you feel is the sort of the solution to this
I have no
growing?
idea.
Yeah.
More talking,
I was just going to say educating, like
more
more
educating.
conversations
Yeah,
like
more
this.
more conversations with people about what makes you feel good.
Right.
Don't even get me started on whether people think they're allowed to feel good or they deserve to feel good. That's a whole nother. But if you can get to the point where you can agree that something makes you feel good,
Yeah.
what is that? And how do we do more of that? Right?
Exactly.
I don't know.
Well, I think this is a start, like
Yeah.
just having the conversations and being like you being open enough to come at it from your perspective, because I think the general public would probably come at you and say, not at you, but would say, okay, well, my doctor's no good, da 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 da. Like it'd be all negative
Yeah.
towards the medical industry.
Sure. Which,
However, there's a whole other side that we need to kind of
yeah.
unravel.
And I believe, I believe the stories people tell about their doctors, and I know a lot of the doctors, and I know that they're exhausted, and I know that they all want to help.
Right.
But for every hour that I see a patient, it's an hour of paperwork. And I don't get paid for the paperwork part.
Right.
So pretty much every family doctor I know spends evenings and weekends after their kids go to sleep on their electronic medical record, trying to read through stuff and, review labs and send referrals and all those other things. It doesn't leave you with much time to listen or really think about things. Or it's sort of like, how do I just keep my head above water?
Exactly.
It's not a good place we're in right now with healthcare. It's not getting better. More is not the answer. But it doesn't make anybody money, right?
I feel like I already have the answer to this question, but I've had many people that have asked this question is that, so you take three different women,
Yeah.
say we're all the same age. We come in and we see you and we're tired and we're not feeling ourselves. Da, 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 da. A lot of these women have said the doctor is so quick to say you're depressed. And I'm like, but I'm not depressed. And then they end up being prescribed the exact same drug, but yet we're so different. Like,
Well, again, that's a rabbit hole we get down, but I find depression so interesting. I love talking about that and anxiety and those kinds of things because depression is only a word we came up with when we had a drug for it.
right.
Like it wasn't a word we used ever. Nobody said I'm depressed. Right? Until we had an antidepressant.
It's fascinating.
So a lot of those women could have been sad. They might have been grieving something. They might have been burnt out or overwhelmed or, a bunch of those different things. And all of those different pathways converge on serotonin. And serotonin is our everything is okay hormone. It doesn't mean everything's okay. It just means it's telling our system everything's okay. So those 3 women could be in 3 very different not okay situations, and that drug will make you feel like it's okay. So it will work, but it will make you feel, it will stop you feeling like I need to do something different.
Right.
If you can't do something different, well, then that's really helpful, right? That helps you cope with the life that you have a lot easier. And a lot of people are just doing that.
So we have to wrap up. I can't believe you're going to be a regular on the show because we have so much to talk about. But can you give some advice to someone that is watching or listening in even from I don't even know what I'm asking you right now. Like what kind of advice, but just someone that's struggling maybe with their family doctor or just feeling like they're not being heard. Like, do you have some tips that can help people?
What do you want to change? If you had a magic wand, what would be different? Be really specific. So some people will say, I want to lose weight. Why? What would be different? What are you doing that you shouldn't be doing, or what are you not doing that you should be doing to feel better? And is there a way to get one step closer to that? Even the smallest little tiny step, right? But I think getting really clear on what's the problem, and then what do you think the solution is, and can you take one step towards that?
I think that's great advice.
And then we start from there.
Right. Because sometimes I'm sure you have a lot of people that come in and say, I just don't feel like myself.
Yeah.
And you're like, okay, well, what does that mean?
What does that mean?
Right?
Specifically, what does that mean, right? So I think it takes a lot more conversations. And a lot of sometimes hard realizations, right, on people's about people's lives and what they're doing, and sometimes they don't want to hear it, and that's okay.
Right.
But yeah, my favorite question I think to patients is, if I gave you a magic wand, like what would you change? What would be different tomorrow? What would good look like?
I'm gonna ask all my older people, more seasoned people that love going out with me. There's a bunch of neighbors that love going out to Swiss Chalet with me.
Yeah.
And all they talk about is their ailments. And I'm like, is this all you guys talk about? And they're like, yeah, like my doctor this, my doctor that. And I want to ask them,
what would good look like?
Yes, I do want to ask them that. I asked them that on Wednesday night. They're like, what do you talk about? Like, not my ailments. I'm talking about a lot of other things.
A lot of other more fun things than that.
Exactly. Well, thank you very much, Dr. Brenna, for being here. And I feel, again, just the fact that we're opening up these conversations are going to help. And hopefully it's heard and it's going to make a difference.
Yeah.
Even if we make a difference in one person's life. So
and it's worth it.
Yeah. Thank you.
Awesome. Thanks.